I get asked all the time, Dr. Karam, can I do a neck lift? All I want is a neck lift. This is the only thing that bothers me. My answer is, sorry, neck lifts don't work. Now I'm going to explain why. Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on today's episode, we're going to talk about why don't neck lifts work? Why do so many people who are bothered by their necks end up going down the wrong road when trying to correct it? I'm going to explain the anatomy, the physiology, how the process of neck aging happens, as well as explaining a very perhaps strong take, maybe even a little controversial, although I don't think so, of why I believe the neck lifts alone are a totally worthless procedure. All right, folks, so let's break it down. The neck is a continuation of the face, right? It really is. If you think about it anatomically, there's a platysma muscle that attaches here in the clavicle. It comes up all the way up to here and then attaches to the facial fascia. The facial fascia then comes all the way up here and then attaches to the temporal bone. So this entire area is one thing. When we are young, this entire facial fascia is snug and tight, and it holds onto the contours of our bony anatomy such that we look like we have a sharp jawline, firm neck, firm mid-face, great position of our outer brows. When we age, typically around the late 40s and early 50s, what you start to see is a downward migration of the brows. The mid-face starts to crowd and get deeper nasolabial folds, then leading to the jawline to start to sag. Then finally, you start to see the neck start to sag down. Why that is because, and this is probably the most important thing I'm going to say, the neck is being held up by the face. So when the face starts to sag, there goes the neck. The upper anchors that are holding the neck up, once they lose position and they start to drift down, well, where's the neck going to go? It starts to sag down. So when you lift the platysma muscle upward, what happens to the neck? It starts to redrape back to where it was. Similar, honestly, to like making a bed, right? I mean, when the bed is all messy, everything bunches up towards the center. When you tuck the bed into the sides, what happens to the center of the bed? It becomes nice and firm and crisp, right? So here's the deal. Naturally, people are sensitive to the shape of their neck because the neck ages in a number of different ways. There's a couple things that happen. Number one, some people get the neck bands, which are the two areas of the platysma that kind of droop down like this. They have a thin neck, but there's this kind of loose banding effect that happens. So that's like a thin neck that has muscular laxity. Then you have a different condition happening to a different person based on different genetics. That is, the platysma is still sagging, but you also get a hypertrophy or increase volume of the fat underneath the chin. This increase in volume under the chin creates kind of like in addition to having the turkey waddle, you get a thickness under this area, which makes that area look heavy. So then you get the heavy neck situation, right? So two different scenarios, but universal in the aging neck is the fact that the muscle is sagging. So when you go in and you ask for some type of a neck treatment, and neck treatments can be a number of different things, right? There could be liposuction, there could be Kybella, which are injections into this area where things get full and heavy, try to decrease the fat in there. You could have an isolated surgical neck lift, where a surgeon makes incisions behind the ear and tries to tuck this area up. No matter what you do, it's the wrong treatment. For years, I've looked patients in the eyes and I've told them this, and they said to me, why? I mean, I went down the street, some doctor told me, hey, I can do a neck lift for you. Why are you telling me that you need to do a face and neck lift? And by the way, let me just back up for a second. My vertical restore, which is a technique that I trademarked, and that's my main vehicle for facial rejuvenation. And you've all seen the before and afters and the powerful impact it has. It's an automatic neck lift as part of the face. What the vertical restore addresses is the lateral brow, mid-face, jawline, and neck all together. No one has a choice to get their neck addressed or not. No one is in a position where they have a decision, I just want a neck lift and I just want to get it. No, it's all happening together. And I did that on purpose because that's, again, the only right way to approach the sagging jawline and neck. And here's where things get really messy. And trust me, when I say this, like I've learned this the hard way because I didn't start off with 20 years of knowledge and 20 years of dealing with patients and seeing some of these surgeries play out, because I've made every mistake you could possibly make, in addition to seeing mistakes that were made. But here's the deal. When a person comes in and you do something directly to this area, right? Whether it's like you make an incision under here and tighten up the platysma, that's called a platysmoplasty, tighten this up this area, take out the fat, take out some skin behind this area and call it a day. Okay, it looks a lot better, trust me. It'll look a lot better right out of the gates. However, there's a few things that look off. Number one is, in those people, they always have a little bit of laxity along their jawline. So now you've got looseness here, but some tighter looking neck here. That's right after surgery. That's right when everything heals up, it's how it looks. Now, one of the most important characteristics of a facial rejuvenation procedure is to look normal and natural. If you've got laxity along your jawline, laxity along this area, well, normally that translates to laxity in the neck. If you go in there and tighten up the neck, but leave this area loose, you look weird. It just simply does. And immediately somebody can tell within a split second of looking at you that something is off. Oh, that's because you've had some kind of plastic surgery. And that's the only reason people can tell when somebody's had plastic surgery, who literally have no idea what plastic surgery is or facelifts are or whatever the situation is. They just know something's off. And if something's off, that usually means you've had some work done. And frankly, that's the number one reason patients come to see me from literally all over the world, is because I create very natural looking results that no one can tell they've had any work done. And part of that is just by using good judgment in terms of making sure everything looks like it belongs together. In other words, you don't have old jawline and old mid-face next to young looking neck. It doesn't exist in nature. So right out of the gates, it looks weird. Second, nothing's stopping this area from sagging. So what ends up happening? Very soon after surgery, I'm talking less than a year, and then from a year on very quickly, as this area starts to continue to sag, the neck starts to sag again. So you get no durability or longevity out of it. So the bottom line is, if you're interested in addressing your neck, just take a second, even though it might be the thing that bothers you the most, take an honest assessment, step back for a second and look at your whole face. It's very unlikely that you have a super tight jawline and a great, firm looking mid-face, etc. It's very uncommon. And if it does look like that, then it's probably just a short matter of time before everything starts to catch up to one another and starts to look even more aged in a harmonious way. So therefore, if we're playing the long game, which if you're gonna have surgery, you're gonna play the long game, because the last thing you wanna do is have surgery and then come back in a year or two and have another surgery, etc., or be disappointed with the changes that are happening here. So bottom line is, if you are finding yourself in the age ranges of your 40s and 50s and beyond, and you're bothered by your neck, you're gonna need a face and neck lift. Now, if you get it with me, you're getting a vertical restore. If you go elsewhere, don't ask them just to do your neck lift. Ask to do a face and neck lift, because you need this area addressed. Now, not all procedures are done equally. The way I do my procedure, it's vertically oriented, and you can do this to yourself. You put your fingers right here on your jawline and you pull upward, and you can see the effect it has, not just on your jawline, but what the effect it has on your neck. So that way you can prove to yourself that by lifting the tissues up, you're gonna get that neck firm and solid again. There are a lot of cases where I do the vertical restore without even making an incision under here, because if they don't have fat in this area, I just want to lift the muscle upward and get that area to be nice and tight again. So it's like a 50-50 situation, because again, like I said, if you don't have fat pad here, you don't need an incision in here to go after this area. I don't do an automatic platysmoplasty on every patient. So the treatment to the neck is through the face, and it's through an upward elevation of this area. Ideally, a surgeon that you go to is familiar with this type of an approach, and they'll lift the tissues up, because again, to give that neck the greatest chance to succeed in the long run, you want to get that traction going upward to basically redrape, tuck that bed in again. A couple other things. Doing liposuction in a neck that is sagging is a great mistake. Why that's a mistake is this: because the neck thrives on that soft fat layer that exists underneath the skin. It looks beautiful, it's sensual, it looks soft. Some people during aging, they lose that fat layer, and then you can see the neck looks really thin and ropey, etc. It's because they lost that subcutaneous fat layer that goes between the skin and the muscle. You want to keep that as long as you can possibly keep that. If it begins to age on its own and you lose that fat, and it ages, it loses it. Last thing you want to do is accelerate the aging process of the fat underneath the neck, which is precisely where liposuction goes. Liposuction goes right underneath the skin, sucks out all that fat. Some people with really full necks, that looks a little bit better right out of the gates, but it ages poorly. It is no good. There's never a scenario where I do a vertical restore, etc., that I actually suck out the fat throughout the neck. When I go and I make the incision under here, I'm actually going directly to the subplatysmal fat, which is a fat layer underneath the muscle, and I'm taking that fat pad out surgically, and I'm leaving the subcutaneous fat to allow that beautiful soft redraping of the neck without any compromise or any damage. That's very, very important. Kybella, pointless, one of the worst procedures that are out there, does literally nothing but damage the tissues and truly doesn't address the muscle laxity either, and neither does liposuction. So you're sucking this out, you're worsening the skin condition and the subcutaneous fat, and you're not tightening up the muscle, which ultimately you need to. So those treatments are big no-nos. Using things like Morpheus 8, etc. I did an entire video series on things that actually age you and the negatives of using deep energy devices like radio frequency that go deeper than like anything greater than 2 millimeters is you're getting into that deep fat layer. So a lot of these devices, they brag about going 4 to 5 or 7 millimeters into the tissues. All you're doing is you're basically heating up the fat between your skin and the deeper tissue and fundamentally causing that skin to damage. That's why so many people complain after these treatments that their neck or their jawline or whatever actually looks worse than it did prior to treatment. So I'm not a fan. Here's the deal. Take this or leave it, but you've heard it here. If you're going to improve your neck, you got to do it through the face. Do it comprehensively so everything looks balanced and looks natural and it doesn't look piecemeal. Nothing looks worse. It's like, taking a kitchen that's built in the 1950s and just changing the countertops and the cabinets, but leaving the ceilings and floor and the appliances the same. It just doesn't look right. And people know when things don't look right and they blame it on plastic surgery, and then you get that stigma of having the done look. Very important. Facelift, neck lift combination, vertically oriented, take that neck up with it. You will win the game in the long run. You'll get a beautiful, elegant change, and you'll be able to kind of put surgery behind you, hopefully for 10 or 15 years, and keep this in mind as well. This is a caveat. No one is going to get a perfect looking neck. Perfect looking necks don't even exist in 20-year-olds in a lot of cases. I'm not exaggerating, they truly don't. Everyone's got a little bit of laxity on their neck. Everyone, when they turn their head this way or down this way, is gonna have some bunching and scrunching of the tissues. Bottom line is, it can only be as good as it can be. As long as the procedures are done, effectively and aggressively, you can rest assured that you got the best result you can possibly get, but you cannot expect perfection, especially out of the neck, and you can't expect anything to last forever either. It's gonna continue to age, it's just gonna age much more slowly if you do things the right way. But the whole point of these type of procedures are to make things better and hopefully leave you looking normal and natural and closer to what you used to look like, and doing so without damaging structures or making things look off. All right, folks, that's the best advice I could give you. Say no to neck lifts, go with the right approaches, send this to some friends and family, people who are in the market and looking for these type of things, save them the heartache. I cannot tell you how many patients I have treated who've had neck lifts alone and come back and they're like, this thing doesn't look right, and now, there's like a whole nother operation I have to do a year later. I hope you got something out of it. If you haven't already, make sure you subscribe to the channel, comment any questions below, let me know if you like it, and again, share it with friends and families. Empowerment, get the knowledge out so people can make good decisions. And if you like content like this, make sure you sign up for the Karam MD Journal, which is a newsletter that I publish, and it comes delivered to your email every single week with knowledge about skin and facial rejuvenation. Great topics, great in-depth stuff to help you get better clarity on the topics related to facial and skin rejuvenation. All right, folks, I hope you enjoyed it. Until next time, Dr. Amir Karam.